You're listening to Focus on the Community, brought to you by Harris Regional and Swain Community Hospital. And today we have Dr. Marshall with us. Thank you for being here.
Yeah, thanks for having us.
All right. You are from the Harris Wound Healing and Hyperbaric Center.
I am.
All right. So tell me, if somebody doesn't know or isn't familiar with your wound care center there or the hyperbolic part of it, what is it that you guys do?
Yeah, so we're located right next to Harris Hospital. We are a wound care center, and we treat all different kinds of wounds, anything from a skin tear, from a common fall, to a complicated diabetic foot wound with osteomyelitis or infection of the bone. And we do a lot of complex wound modalities, such as cleaning up the wounds, and we have some complex fancy dressings to put on wounds to help them heal. Mm-hmm. But more than that, we also really tackle why the wounds are occurring, and we sort of employ this complex decision-making process that Healogics has developed over years. It's a 7-step model to look at why the wounds are occurring, what can we do to help prevent the wounds from reoccurring once we get them healed. Mm-hmm. And part of that process is hyperbaric oxygen treatment. Hyperbaric oxygen treatment is not for everybody, but for some patients, it's amazing at helping wounds heal themselves. And it's basically the patient would come into the wound care center, they would lay in this chamber for a few hours, and it's clear, it's open.
I was going to say, I have a picture of it here. Yeah. I have like a little diagram of it. And, if you're thinking that you're going to be claustrophobic or whatever, it's nice and clear. You can watch a little TV screen while you're laying in there. Yeah. So who do you think would be good for this treatment, this type of therapy?
So we have a specific criteria for patients that we can treat for these wounds, and the government kind of mandates for us who that is. Mm-hmm. But for a lot of patients, it's people who have chronic diabetes, who have wounds from these diabetes, who have infection in the bone, and it's not been healed with the normal routine medical care, mm-hmm. such as long-term antibiotics, people who have failed just debridements, things like that. Mm-hmm. People who have had radiation for different types of cancers. Some men have had radiation to their prostate or radiation to their bladders, mm-hmm. And they're developing symptoms and chronic pain from those types of radiation modalities to treat their cancer. We'll see those patients in the wound care center and offer them hyperbaric oxygen treatments and really get dramatic success with those.
That is fantastic.
Awesome.
And one thing I know that we're here to kind of talk about today, September is PAD Awareness Month. So if somebody doesn't know what PAD means, would you tell us what that means,
Sure.
what the acronym is for, and then what it is?
Sure. So PAD is PAD. It's peripheral arterial disease. And September is PAD Awareness Month. So we're trying to get the word out there for people who may have PAD already or who are at risk for developing that. And anybody over the age of 50, anybody who currently smokes or who used to smoke, mm-hmm. anybody with diabetes, anybody who has a diagnosis of hypertension, hypercholesterolemia, or kidney disease, they're at a risk for developing peripheral arterial disease. And what that means is that the arteries are basically the hoses in our body that carry blood from our heart to every other organ and all of our fingers and toes. And veins are the hoses that carry them back. Mm-hmm. So it's kind of like, it's almost like you'd call a plumber to fix the clogs in your drains and your pipes. You're calling on the heart doctor or the arterial doctor to fix the clogs in your arteries. And arteries can get clogged just like the pipes in your house can. They can develop debris and plaques and things like that, which limit the blood flow to your feet and to your toes. And peripheral arterial disease is just that. It's thickening of the arteries, hardening of the arteries, and it can. And we're trying to bring awareness to this because it can lead to wounds, mm-hmm. and wounds on the toes, wounds on the feet. And there are millions and millions of Americans who have these wounds. There's over 200,000 people a year that have to have amputations for these wounds.
Oh, wow.
And so it's a serious, serious business. And it's something that if you can catch it before it happens, it's so much easier to treat than after it happens. And but if it does happen, you do give it a wound, then that's when you come see us.
All right. And what are some of the common signs and symptoms of PAD? So maybe people are having some problems, but what are the most common things that maybe they need to get it checked out?
Some of the more common things you'll get is pain when you're walking, or they call that claudication with ambulation. So if you're walking around doing your normal activities of daily living and you're getting pain in your legs or your feet, any numbness or tingling that you're starting to experience in your legs and your feet, if you notice that your legs or feet feel mm-hmm. cooler on one side than the other, like if the left leg feels a little cool and the right leg feels normal, or both, those are all signs and symptoms of developing peripheral arterial disease. Those are the early ones. The late ones are blisters or wounds. And if you have a blister or a wound, usually you've already had peripheral arterial disease for some time, and you're developing the kind of consequence, or what we call the sequela of that medical disease, which is a blister or a wound, and you need to come to the wound care center.
All right. Well, thank you for being here. We're going to talk more this week about September being PAD month. We're going to talk about the signs, the symptoms, how you can treat it.
Sure.
We've been talking to Dr. Marshall, who's from Harris Wound Healing and Hyperbaric Center. You can call 828-586-7910 for more information. If you just want to touch base, maybe there's something that you got going on that doesn't look quite right, a wound, you could give the office a call and
Absolutely.
have that checked out. So we'll talk to you more this week about that.
All
Thanks
right.
for being here.
Thanks so much. Appreciate it.
You've been listening to Focus on the Community, brought to you by Harris Regional and Swain Community Hospital.